Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. February is Heart Health Month, and here's a short health talks about cardiac care from Baptist Health.
Heart disease is the #1 killer of both men and women in Kentucky. We still live in a tobacco-dominated state, and so I still have a lot of smokers as patients and a lot of people with genetic risk factors, family members who've had heart attacks. Generally, people are sent to me for something that's found in their primary care doctor's office, or they're sent to me because of symptoms, and those might include chest pain, shortness of breath, or heart racing symptoms. I like to divide the heart into 3 sections using the house as an analogy: the plumbing system, the foundation, and the electrical system. The plumbing system would be evaluated on a stress test, so that's looking for blockages. A stress test involves walking on the treadmill, and then we look at the heart before and after with different types of pictures. If you have a murmur or a structural heart problem, that's evaluated on an echo, which is an ultrasound of the heart. And then a heart monitor looks at the electrical system of the heart or heart rhythm issues. If you're getting a heart monitor, it's usually a wearable patch, a sticker that's placed on your chest, and you usually wear it for several days up to several weeks. I've got a lot of patients who are motivated after finding heart disease, who go to cardiac rehab programs after a stent, who really get better exercise endurance, who get better with their shortness of breath, and they do well after that.
There's over 735,000 patients that have a heart attack every year. And about 2/3 of those patients, that's their very first heart attack. The major warning signs for a heart attack would be chest pain or chest discomfort, pain in the left arm. You might get pain that radiates into the neck or the jaw. Sometimes you get extremely sweaty. And then we also know that women present a little bit atypically. They tend to have more GI symptoms. So they might get a burning in the stomach that kind of radiates into the chest. The sooner you suspect a heart attack and the quicker you get medical care, the faster we can intervene and abort the heart attack.
I was walking and started having some abnormal feeling, kind of tightness in my throat, not so much my chest. When it got worse, and it actually, when you're walking and it stops you in your tracks, and you have to stand there wondering if you're going to be able to stay on your feet to endure it to pass, that's what gets your attention right here. Right now is time. So
the standard treatment is to go in and basically open up that blockage. We do that with a procedure called coronary angiography, or a heart cath. We go up, put very small tubes into the arteries of the heart and look at it under an x-ray, and that'll identify the blockage. If we do find blockage, we can then use balloons and stents to open that artery up. And the quicker you get that artery open again, the more potential heart muscle we can save, and the better patients tend to do. After that, we're pretty aggressive with modifying risk factors. One of the most important things we do is get patients enrolled in cardiac rehab, which we also have here at Baptist Richmond. So within about 2 weeks, we get them enrolled in a monitored exercise program. My hope is that they will actually come out feeling better than they did prior to their heart attack.
Despite all the efforts, heart disease remains the #1 cause of death all over the world, especially in the United States. And based on research, we know that there are 7 features which can lead to an event-free, heart-healthy life. And these include no smoking, no consumption of processed sugars, carbohydrates, or saturated fats, regular exercise, including 30 minutes 5 times a week, or at least 150 minutes per week in different divided intervals, a blood pressure goal of less than 120/80, fasting blood sugar goal of less than 100, total cholesterol goal of less than 200, and a BMI or body mass index of less than 25, which is a ratio of your height to weight. It is easy to ignore your health, but a little bit of effort, minor changes over a long period of time can have excellent long-term benefits. It is a proven fact that family history and genetics plays an important role in developing heart disease and all other diseases. However, just because your father, mother, or your family has suffered from a heart attack does not mean that you should fall victim to the same disease. You can be more aggressive in modifying your risk factors, taking care of your health in better ways, and prevent that heart attack.